Let's talk about one of the most dangerous mistakes that I see when people use compounded GLP-1s. I'm Tiffany. I'm a physician assistant, but also a GLP-1 advocate. I help people get access to GLP-1s that can't get them through traditional insurance. So if you're struggling with that, there's some links over here in my bio that hopefully will help you out. So I'm going to try to explain this in super plain English so that it's very easy to understand, because I feel like this is one of the most misunderstood things when it comes to compounded medications. First up, I want you to think about pills. If I hand you one ibuprofen pill, that's 200 milligrams. If I hand you two ibuprofen pills, that's 400 milligrams. Pills are pretty easy because one pill equals one dose. But compounded medications are liquid, so this changes things. The liquid depends on how strongly it's concentrated. So think of this example. If I mix up a gallon pitcher and I'm making Kool-Aid, and I put one Kool-Aid packet in that gallon pitcher, pretty mild Kool-Aid. But what if I mix up that same pitcher, same gallon, and I put 3 packets in it? Much different concentration, right? A lot more sugar in that pitcher. So GLP-1s and all compounded medications actually work the same way. They can be different concentrations. So yours might be 2 milligrams per ml, or it could be 5 milligrams per ml. So the exact same amount of liquid will contain 2 different amounts of medication. So imagine if you get a coffee every day and you normally get 1 shot of espresso in it, but the barista messes up and one day you go in and get your coffee and instead you get a coffee and it has 3 shots of espresso in it. It's the same coffee you always get, it's the same volume, it's the same size of coffee, but much more strongly concentrated. So this is the reason that some people can accidentally overdose on their compounded medication if they're not very careful about what concentration they are taking. And here's where things even get a little bit trickier. Most compounded medications, GLP-1 specifically, are drawn up with an insulin syringe. Okay, an insulin syringe is very small. Its complete volume, if you drew it all the way up, is 1 ml or 1 milliliter, but that comprises 100 units. So for the most part, when we're talking about insulin syringes or how much volume to draw up, we're going to be talking about this in units. So a lot of you are going to be taking so many units per week. Now, the one thing that never changes is that 100 units always equals 1 milliliter. So that never changes. No matter where you're at, what medication you're on, this whole syringe, 100 units, is always going to equal 1 ml. So it is so important that you are working with a provider that is going to give you exact instructions on exactly how much medication you are supposed to be drawing up and taking every week. I see a lot of confusion and a lot of mistakes, and this can lead to people getting sick, nauseated, dehydrated, and even some ER visits. So if you're currently working with a provider that you feel like is not giving you clear information and advice, I've got some better options for you in my bio with a provider that is going to give you clear, consistent information. So just know that you're not supposed to know all this, okay? Math is not everybody's ministry, and that's okay. And as a provider, I would never expect my patients to calculate their own doses, okay? That's not appropriate. So I always give my patients clear information I provide to the pharmacy, and then the pharmacist should be calculating and putting that on your prescription. So if that's not happening for you, then please clarify with your provider or your pharmacy what you're supposed to be doing. Any other questions, please drop them in the comments.